Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents. Are you a mother?
Hello, everyone, and welcome to Ask the Pediatrician Hour. I am Gbemisola Boyede. I'm a pediatrician, and I'm your uncle for today's program. And before I start, I just want to welcome you from whichever platform you're listening to me this morning or afternoon or whatever time of the day that you're listening. Thank you so much for joining us. For those of you who are watching on our Facebook page or our YouTube channel, I want to say thank you so much for joining us today. And for those who are watching us on our YouTube channel, you're welcome. And for those who are watching or listening on Fresh Waves Radio Facebook page or listening directly on the radio, I want to say thank you so much for joining me this morning. And I want to also especially thank those who are listening on the podcast. Thank you so much for joining us. Welcome to ATP Hour. Ask the Pediatrician Hour is a program where we discuss important health issues, usually that affect our children. But today there's going to be a twist because yesterday was the International Women's Day. And I want to say happy International Women's Day to all our mothers, all our ladies, all our girls, everyone who is of the female gender. Happy International Women's Day to you. Thank you so much for all that you do. And for us on Ask the Pediatrician Foundation, this is a woman-founded initiative, and we have over 75% of our volunteers, of our members are women. So it's actually a very, very important day, and we want to especially celebrate all our women today. And because of that, I'm going to be taking a detour from talking about children health issues today, and I'm actually going to talk about women health issues. Now, women are quite important when it comes to children. There's what we call a dyad between the child and the mother. So we as pediatricians, we're very, very interested in the mothers and in the health of mothers. So in honor of the Women's International Day that is celebrated every 8th of March each year, today I'm going to talk about important issues that affect our health as women and what we can do, or what we should know about them, and what we can do about them, because you are very key. You know, the hands that rock the cradle is the hand that rule the world. So women are quite important. For our children to survive, we definitely need our mothers. So mothers and their children survival are intrinsically link, and that is why most time these days we don't just talk about newborn survival and all that. We talk about maternal, newborn, and child health, because we realize that maternal health, the health of the mothers, the health of ladies, even girls, are very, very vital to those of us who are in the field of pediatrics. And so today we'll be talking about women health issues. You know, we want to talk about our women. What are those important things that have to do with our health. And being a woman is it comes with its own challenges, okay, and it has significant impact on health. And there are some things that are especially peculiar to women, okay. Women, give birth to children, which men don't. And because of that, there are certain risks, there are certain health issues that comes related to that. And also there are a lot of differences between men and women. And also there are other factors that are not even have to do with the biological gender, but it has to do with the societal, construct on women. And we're going to talk about things like violence against women and all that. It also impacts on the heads of women. So women are very important, who are very crucial. And so today I'll look through the World Health Organization, and we'll look at what are the top 10 health issues that affect women, and what can we do to ensure that our continue and this is that is there for us to take care of our children, to take care of the family, take care of the society. We really need our women. So today we're going to be talking about those 10 top priorities when it comes to the health of women. So if you please subscribe to our channel, and remember that you can always watch our past episodes on all this platform where you're watching right now. Remember that you can also post any question you have about this topic or any other topic we've discussed in the past on Ask the Pediatricians Facebook group, and our professionals, moderators, they'll be there to answer your question. So welcome everyone, and today we're talking about women. We celebrate our women, but there are health issues that are very crucial when it comes to women, and it's so important that women should know about them. And even those of us who are like the friends, the husbands, the brothers, and all that, we should be informed as well, and we should try to see how to support the health of our women. All right, let's start. The first thing that affects health of women that is of great concerns to professionals of the World Health Organization is cancer. Yeah, women have cancers just like men, but there are some cancers that are peculiar to women, and these are the leading causes of death for women, especially in countries like in all over the world, even in countries with advanced health and all that. We know that cancer is something that we still battling with. We don't really have the cure for all these things yet. So it is the most important thing when it comes to cancer is early detection and quick action about them. So when we talk about cancers, what are the two top cancers that affect women? Yes, you're right. Cervical cancer and breast cancer. These are the top two that can lead to death of women. However, we know that these two can be detected early, and that is why screening for these cancers are so crucial. So women, as you're celebrating your day, as we're celebrating you this month, I want you to be very alert. We don't want you to be stolen away from us by cancers, by cervical cancers or by breast cancer. And this requires early detection, and most countries have this detection surveillance put in place. But sometimes some of us as women, we don't take this thing seriously. I know you're so busy taking care of the family, taking care of our children, but you also need to take care of your own health as well. And it's so important that you go for regular screening. So for cervical cancer, it is something that if we picked it up early, it can be cured, just by diagnosing it early. But when we're picking it up in the late stages, it's usually, difficult at that point. It's almost like a death sentence. And the easiest way to pick up what we call cervical cancers is through what we call the pap smear. So once you are sexually active and you're having children, you must go for regular pap smear, and we recommend that you go every 3 years. Okay, all women of reproductive age who are sexually active should go for pap smear. It's a very simple procedure. So what they do is to take a swab of that cervical of the area, and then they send it to the lab, and then they look under the microscope to see whether we can find any abnormal cells. Sometime before the cancer start, it starts by force for the cells changing. And when we notice that these cells are changing, that means the cancer is just about to start. We can cure it at that point. We can treat it. They can, kill this immediately. So we don't want to wait until you start having symptoms of bleeding in between, sex, or bleeding, unnecessarily, or having pain. Those are late stages. So when you are not having any symptoms at all, that is a time to pick up cervical cancer, and anyone who is sexually active is predisposed to cervical cancer. So early screening, pap smear, you must do it. You must do it every 3 years. So usually some countries, the doctor will send you a letter to remind you, usually after you had a baby, when you go for your 6 weeks postpartum check. This is one of the things doctors also do. They will recommend you do your pap smear so that we can check to make sure that the cervical cells are intact and there are no evidence of cancer changes, that we can, if there are, we can easily deal with them. So please make sure you go for your screening. All right. So these two cancers, cervical cancers, breast cancers, they are very dangerous. They can kill. They are the leading causes of death in women, but we can detect them early and they can be prevented. And also, we also have what we call the HPV vaccine, the human papilloma virus, because one of the commonest cause for cervical cancer is the infection with HPV first, set the stage, and then later on the cells of the cervix can be transformed and become cancerous. But when this vaccine is given, usually from the age of, some give it as early as 7 years, 8 years old, or in teenage years, or even for those of us who didn't get it when we're younger, now we can still get it as older women, and there are about 3 doses of them, 2 or 3 doses. You get all of them, and then you'll be protected against HPV infection, which has been linked to cervical cancer. So preventing cervical cancer, HPV infection vaccine, and pap smear, very important. Number 2, cancer, breast cancer, and again, examining our breasts. We must learn to examine our breasts at least once a month. You can do it usually maybe after your period, you finish your menstrual period, or you can just have your own time and you can just, examine your breast. There are lots of videos online teaching you how to palpate your breast, how to feel for lumps, and if you notice any lump, you have to go to the hospital. You go to the hospital, usually from the age of 40 or 50, we begin to do what we call mammograms, where they take x-rays of the breast to see whether there's any abnormal lumps, or for younger women, just make sure you palpate at least your breast every month, and if you feel any lump, go to the hospital. Sometimes it may just not be cancer, it may be just normal lump, but we can take a sample of it, we call it biopsy, a fine needle biopsy, and they will just take it to the lab and check whether it is a normal lump or whether it's a cancer type. Usually, again, if we pick this thing up in this early phase, we can take out that lump, and most time you'll be fine. Sometimes we need to give chemotherapy or radiotherapy, but sometimes we don't even need to do that, just the surgery, and that will be the end of the cancer. So there are other cancers in women, but when it comes to the leading ones, cervical cancer and breast cancer, the good news, women, we can detect them early if we look out for them early. So we don't wait until symptoms start. We are actively checking to make sure we don't have them, and we'll pick up anything either through the pap smear, through the breast examination, self breast examination, or through the mammogram. Then you refer to the appropriate quarters and the specialists can take care of it. All right. So when it comes to health of women, those two cancers are the monsters, and the best way is to make sure we are aggressively looking for them, picking them up early, and getting rid of them. All right. So now let's go to the second thing when it comes to the health of women. We're talking about reproductive health. Again, this is what is unique to women. Women were the ones that get pregnant, we're the ones that have children. And in my culture, in Yoruba language, when a woman has a baby, they greet you and they say Eku Iwomo. It means you have just gone through a dangerous process. You have just escaped death, literally. That is what it means. And it is actually true because a lot of women lose their lives in the process of pre-pregnancy, having a baby, or after having babies. We all know of someone, close to us who have died in the process. It's really in Africa where we see almost 800 women who would be dying per thousand. That is huge. We thank God it's coming down, but it's still huge. A lot of women dying from having a baby. It shouldn't be. We as women, one of our key uh, uh, ability is ability to reproduce. We are partner with God in the process of recreation, of making sure that the world goes on, with bringing up new lives into this world. And yet, unfortunately, this important role should not be our death. It should not lead to the death of a woman, and that is why it's so important that our reproductive health, we take it very seriously. And how do we do that? Number one, don't get pregnant when you don't want to get pregnant. I know in some parts of Africa, especially Nigeria, we don't plan our pregnancies. It's like the pregnancy just fall on you. So as a married woman, people just see you get pregnant, and nobody asks whether do you really want to be pregnant. So, and that is why I've slashed it with family planning. In other words, let's be pregnant intentionally. So when you don't want to be pregnant, please, there are a lot of family planning options for you. So number one, making sure we just get pregnant only when we want to get pregnant, making sure we have only the number of pregnancies we want to have. And these days, with the cost of living crisis and everyone, most people just want to have like 3 or 4 children max. So we shouldn't just be having children, it's good to have a lot of children, but remember that each pregnancy is a risk. So you don't want to push your life through unnecessary risk. And those days people tend to have a lot of children because they are not sure, because the child death rate was so high in those days. So people want to have a lot of children because they are not sure who is going to survive. But we're no longer living in that century. Now we're in the era where we're sure, thank God our child health statistics are improving. We're not yet there yet, which is one of the things we do on ATP. We don't want any child to die, but we just want to make sure if you have only 1 or 2, you're sure they're going to survive. So there's really no reason for having 3, 4, 5, 6 children. I see women asking me they want to have 5 children, and they're having CX each time, and they still want to go for the 5th one. And I'm like, seriously? Why do you want to just kill yourself? What do you want to do with all those 5 children? Really, you're not the only woman. There are other women who can also bring out children. So please, let's have the number of children, the number of pregnancies that we really think is okay for us. And let's not just have it, keep getting pregnant as if it's for fun. No, each pregnancy is different and each of them is a risk, okay? A lot of women are still dying from pregnancy related complications. So you want to limit the number of pregnancies, you want to space your pregnancies, all right? So lots of some women, just get pregnant every year, and that's because we don't use family planning. So you don't have to get pregnant every year. The issue is that each pregnancy takes its toll on your body. you're using all your body is involved. So you need time to relax. You need time for your body to get back to normal, to go back to base before you go on another journey. And we advise at least 2 years space in between those pregnancies. All right. So you're pregnant in 2021. Please don't get pregnant in 2022. At least wait until 2023 or 2024 before you embark on another journey. And the way to do that, make sure at your 6 weeks postpartum check, make sure you go for your family planning. There are different family planning methods. Lots of women believe, oh, family planning, and that means I'll become infertile. That is not true. Those are myths. Some people say, oh, we'll get fat. There are family planning methods that can have side effects of, weight gain, but there are some that don't. So you can use coil. So there are different options. Your family planning provider will discuss with you depending on what are your health issues. So please don't try and do it by yourself. Discover your family planning provider. So there are methods we will not give to those who are already big. There are methods we will not give to those who already have high blood pressure. We won't give you hormonal methods, for example. But there are other methods that don't involve hormones. There are barrier methods. There are methods that like coils and all that. So depending on your health status, depending on what you prefer, there are different methods. There are people that don't like taking tablets. There are people that prefer injections. There are people that want something that they just put in there and forget. So whatever options you have and what kind of health, your health, previous medical history, the provider will give the best options, and then you can pick one of them. Please, let's number one, have just the number of pregnancies we really, really need. Number two, let's space them. Let's use family planning in between. Now, when you're pregnant, please register in a proper setting. Some of us get pregnant and we just want to go to church or mosque or the traditional birth attendants instead of going to the hospital. All right. Each pregnancy is different. Sometimes some pregnancies are just so fine, no problem. We call them low risk, and you are fine and the baby is fine throughout. That is good. But sometimes we never know when you're going to have the high risk pregnancy. So some people will have high blood pressure during pregnancy. Some people are going to have diabetes, gestational diabetes. Some people will have other issues. And if you already have health issues, or like you already have things like your sickle cell disease person, or you already have a heart problem or kidney problems, there are risks with your own pregnancy. So you need to be with a specialist. So please register in the hospital. So if your pregnancy is low risk, like you've had babies before, this is not your first rodeo, you've had babies before and you are fine, you are strong, you are healthy, of course, you can meet with the midwives and or general doctors. But if you have had bad obstetric history, uh, you've had previous losses of pregnancies, this is your first time, or you're an elderly mother in medical science is anybody above 35. I know a lot of people don't like that when I talk about that, because this many of us are getting married late. Somebody just had a baby at 47. Yeah, which is good, but that is not the ideal. We really want you to have your baby between 18 and 35 years old, which is so anything above 35 we call it elderly primary, if that's the first time you're having your babies, because there are other risk factors for having your baby so late. So all those risk factors, these are the things that will require that you be with a specialist, an obstetrician who will monitor you closely, who will monitor everything. They will check your blood pressure, they will check your urine for sugar, for protein. They will check everything, check your blood group, check your genotype, check everything so that they can prepare and monitor that pregnancy properly. So it is so important that we register in the appropriate with the appropriate specialist and the appropriate setting. Okay, so I've kind of grouped both reproductive health and family planning and pregnancy together because they tend to work together. And please, even after you've had your baby, and when you're having your baby, let's just quickly touch on that. Please cooperate with the doctors. We are not trying to make life difficult for you, and everything is not about money. It's about your survival and that of your baby. And please, pushing a baby through your vagina does not make you a superwoman, okay? And having your baby through CS does not make you less of a woman, because I've seen some write up or some things people write and say, oh, you are not a real woman because you didn't have a vaginal delivery. Please, if you are one of those women saying that, stop, all right? Don't push any, and if you've already had 2 CS, please, all your babies are going to be CS. Don't try to go for vaginal delivery. I've seen women lose their lives over these silly things. All right, you already have 2 CS or 3, and the doctor's already telling you that this fourth one is going to be CS. You say, oh, I want to prove myself. I'm an Hebrew woman. You are not an Hebrew woman. You are a Nigerian woman, okay? Or whichever country you're from. You are not an Israelite. So please, you are not proving yourself to anyone. Whether you had your baby through CS, whether you have your baby through vagina, or whichever method you have your baby, the most important thing, which I always try to tell mothers, is that you are alive and your baby is alive and your baby is fine. That is the most important thing for us. We don't want to have a live baby and a dead mom. We don't want to have a live mom and a baby whose brain is already damaged from the stress and the distress of labor. So please cooperate, all right? You are not less of a woman because you have the CS, all right? Some of us have had CS for our babies and we're fine, and our babies are fine, okay? And we're still women, all right? We're strong women as well. So whether you have your baby through vaginal delivery or whether you have your baby through cesarean section, you are still a woman and you are still a good woman. You're still a strong woman. So don't let anyone get you messed up. Don't let anyone confuse you. You are a woman. You're a strong woman. You are not proving your being a woman or your femininity through having a baby. All right, no, you don't need that. Your gene, your chromosome XX is all that we need to prove that you're a woman. So whether you don't even have a baby at all, you're still a woman. So don't let anyone get you confused. And please, this is so important for your life and for your health. So pregnancy, spaced, limited, family planning, when we're pregnant, getting registered and monitored by the right professionals, these are very important and very key to the health of women. All right, let's move on. Another important issue when it comes to health of women is HIV. I know HIV is kind of, we are overcoming it gradually, but it's still with us. Some women are living with HIV. Most important thing is please make sure you see your doctors, you take your medication. HIV is now like a chronic disease. We have gone beyond the age where people are dying from AIDS and all that. Thank God for the antiretroviral medication. So, the first thing that you must be tested, okay? So when you go for antenatal care and all that, they will always take the opportunity to test you. Some of us during our employment screening, and we're testing not to discriminate, not to say, oh, you have HIV, I don't want to know. No, not for discrimination purpose. You are being tested so that we can pick it up early, and then you can get the right treatment. And HIV is not only contracted through sex, there are other ways, blood transfusion, blood contacts and all that. And so the fact that somebody have HIV does not mean, oh, they've been promiscuous or they've done this or that. No, let's not stigmatize those who have HIV. There are many other ways that people can get HIV without having been sexually promiscuous or anything. So we test so that we can pick it up early, because again, just like any other thing else, when you pick it up early and you start treatment, people live normal lives. So when people are taking their antiretroviral medication, some of them have what we call undetectable level of HIV virus, which means they are more or less not having HIV in quotes, because the virus is down, the viral load is almost undetectable. So please make sure you get tested. At the same time, please do not put yourself at risk of HIV. Avoid unnecessary blood transfusion. If you don't need blood, all right, don't get one, all right. And also, please don't share sharps. Some of us just bleed anyhow when we just leave it anyhow. We have to be very careful. Things that have to do with body fluids, sharps, that we have to be very, very careful. And if you're married, it's always good to be faithful to your partner and also ensure that your partner is faithful to you. If you think your partner is not a faithful one, then you better consider using barrier methods of protection, especially during sex, like using condoms and all that, and making sure that you are getting yourself tested regularly. So these are other ways by which we can protect ourselves from HIV infection, and by making sure we stay faithful to our partner. For those of us who are not yet married or in that category, then abstinence is actually a good thing as well. You just stay away from sex until you're married and you're in a committed relationship with just one person. All right, so that you are not putting yourself on. HIV has not gone away. I know we've kind of down, because we have been dealing with corona and all the other kind of issues, but HIV is still more or less with us. And close to HIV is also sexually transmitted infections. Again, women deal a lot with it. Interestingly, women tend to have more STIs than the men because women's genitals is wider surface and all that, so they tend to have it. So again, similar to HIV, don't have sex with multiple partners. Stay committed to your home one partner preferably, and also make sure that you get yourself tested if you have partner that are not faithful. And if you have sexually transmitted infection, please get it treated. Most of the STIs are treatable and curable. All right, so don't let anybody kind of make you feel afraid. They start talking about all this herbalists in Nigeria, for example. They were advertising staphylococcus, gonococcus, and making those things look so big and scary to people. Really, most of them are just bacterial infections, and there are antibiotics for them. But the challenge again with STI is that sometimes you don't treat on time, it can ascend, it can cause what we call pelvic inflammatory disease, and that can affect fertility for women. Again, women. So please make sure you are protecting yourself. And if you are not sure, then you may want to insist on your partner using condoms so that you protect yourself at least from sexually transmitted infections. These are issues that women have to do with some of the time, and sometimes it's not their fault, because it takes two to tango, but you have to make sure that you protect yourself from sexually transmitted infections. All right, for this one just joining us, we've been talking about women health issues. I've been talking about issues that are very important when it comes to the health of women, and I've talked about cancers, cervical cancer and breast cancer especially, and which are the leading killer diseases in women, and what can we do to protect ourselves from these killer diseases through screening. We've talked about reproductive health, again something peculiar to women. We are the one getting pregnant, we are the one having the babies, and unfortunately this can be a killer, especially in some of Africa and underdeveloped countries, where a lot of women, hundreds of women, are still dying from pregnancy related issues. And we've talked about how we need to space our pregnancies through family planning and making sure we have only just the number of babies we need to have, and making sure pregnancies are monitored and supervised, and delivery also supervised, so that we can have successful pregnancies without losing our lives. We've talked about family planning, we've talked about HIV and sexually transmitted infections, and how we can protect ourselves. Now let's go on to talk about another important thing that has to do with health of women. And I know some of you wonder, why am I talking about violence against women when we're talking about health issues? Yeah, it's an health issue. All right. A lot of women are suffering domestic violence or gender-based violence, depending on whichever terminology you want to use it. But the common denominator is that women are facing violence. In some places, it's due to culture. We've heard of things like honor killing and all that. In some places, it's due to The fact that women are looked at as properties that are owned. So we see women that should be perfectly healthy, being sick, being punched, pushed, just because of the whatever relationship or partner they have. So we really need to stop violence against women, and the way to stop it is that women, we must say no to violence. You don't have to stay in a relationship if you are experiencing domestic violence. You must learn to speak up. Almost every week, here and there, we hear of another woman who has died from violence. I was reading just this week about a man in Nigeria that strangled his pregnant wife, to death, all because the woman did not get up and open the door, the gate to his house for him on time. He became upset and strangled the woman to death. I mean, can you imagine that? And so that is why it's an health issue. Violence against women. Women are dying from violence. Women that are perfectly healthy, they are not dying from pregnancy, from reproductive health issue. They are not dying from cancer. They are not dying from all those other conditions I've talked about. They are dying from violence, from their partner, from and from husbands and all that. This has got to stop. And we women, we must stand up and say no to gender-based violence. We must say no. So if you're in a relationship, the man is already abusing you, either emotionally, verbally, and all that. You don't have to wait until the man strangles you to death. You need to leave. To live, you need to live so that you can live. All right. So we as women, we of our boys, we have our men, we need to let them know that it is not right to eat women. It is not right to be violent towards women. Women are meant to be protected. They are meant to be pampered. They are meant to be supported. All right. So no, we say no to violence against women. And if you are in a relationship that is violent, I know sometimes people are in this relationship and the man is always saying I'm sorry after being after they've done all this abusive behavior. You don't have to keep on saying, yeah, you please get out, ask for help. There are lots of agencies that support women. Just Google them. I'm sure you will find one. Even the FIDA, Association of Women Lawyers, they are there and they have branches in almost all the states. You can go to them. They will sure to make sure that you get out and ask for help, speak out. People will be happy to help you. So don't die as a woman in a violent relationship just because you want to remain married or you want to retain the MRS title. No, your life is at stake here. And like I said, we're talking about these are important issues. These are the killers of our women, violence, and it's got to stop. And we really need to make sure there are, legislation in place and all that. We really need to make sure that women are not molested, women are not killed because they are women. That's all. So that has got to stop. These are another health issues that affect women. All right, let's move on to mental health issues. Mental health issues affect both men and women, but I think women also have, a huge burden of this. So depression, anxiety, and all that. These are issues that tend to affect women more. I guess we are more emotional than men generally. So seek help. Okay, I've seen a lot of women who are suffering postpartum blues, and so this is again related to reproductive health, postpartum depression, postpartum psychosis. So if you feel, you don't have to feel strong all the time. And I know we live in a culture, some of us that preach you have to be a strong woman, you have to be, it's okay not to be strong. It's okay to be weak. It's okay to ask for help. There's nothing wrong with that. So I've seen women sometimes asking questions, and when they're talking, I can see that they're depressed already. I can see it. Though they ask a question about their children health issues, or they're asking about something else, but the way they're putting those questions, I'm tired, I'm frustrated, I'm this and that, I don't even feel like being with my baby anymore. Those are signs of depression. These are signs, that you need help. So please ask for the help, so that you don't get to the point of, suicide and all that. We want to make sure our mental health and anything that stresses you. And please, these days, there's really no need to try and do it all. Let's just forget that superwoman and cape and just drop it, okay? You don't have to be the only one working, cooking, cleaning, doing everything. Please get help, okay? This is one of the things I love about the African culture of the Omugo, like the Olojojo in Yoruba, like when the grandparents, come over, the grandmothers usually, to assist the new mom to help her navigate that first few weeks or months of having a new baby when it's all overwhelming. That's a very, very lovely and positive culture if done properly. So, but bottom line is ask for help. If you need to give out contract things out, if you need somebody to cook for you, if somebody needs to clean the house, let somebody do it. You don't have to always do everything and get yourself overwhelmed. Make sure you maintain your friends, have people do things that make you happy apart from all the work that we always do, which never ends. Have at least 1 hour of time during the day when you just do what you love, whether you want to read a book or you want to go for a walk, you want to swim or you want to watch a movie. Just do something that you like that makes you happy. And if you think you're having any issues mental health wise, please get the needed help. Let's take out that stigma, around mental health issues. So people who have mental health issues are not mad. They have mental health issues just like any other illness that anyone can have, just like depression and all that. And there is help. There are drugs, there are therapies, there's support available, but we must go for them and we must get them so that we can be healthy. All right, now let's go to the last one. Let's talk about non-communicable diseases. Non-communicable diseases are diseases that you don't transmit to other people, but you can have, and they can affect your health. This affect both men and women, of course, but it's also important when we talk about women's health. So we're talking of things like hypertension, things like diabetes, and all that, obesity, and the rest of them. Please, we need to we women sometimes we tend to put ourselves last and we tend to care for other people and forget ourselves. No, please don't. We need to make sure we check ourselves. Let's go for regular checks, let's check our blood pressure. I had an issue instance, one of our volunteers telling me she had what we call diabetic ketoacidosis. She was almost unconscious and she was to be rushed to the hospital. And I asked her, were you diabetic before? Oh, she said, I thought it was just little sugar. I don't know. I was, she didn't know that she's really having diabetes. She just thought it's something that comes and go. No, if you have diabetes, you need to monitor it. You need to treat it properly, and you need to be checking your blood sugar and all that. If not, we're going to end up with crisis that can be fatal, and which is, which can happen. So let's check our blood pressure. If you are hypertensive, you need to take your medication, reduce your sugar, exercise, keep, be healthy. The same thing for our diabetes. Check our blood sugar. Sometimes you may need to be on medication. Sometimes it's insulin. Whatever your doctors recommend, you need to check it and you need to make sure you are doing the right things. So these are all the things we need to do. Let's make sure we have time to check our own health as well and not just, take care of everybody else and forget ourselves. So all those non-communicable diseases, they can still happen in us as women as well. Even road traffic accidents as well. Smoking, let's not smoke. Alcohol use, those kind of things, we need to either stop it completely or use just very minimally. Those are things that we need to do to make sure that we keep ourselves healthy. Let's exercise the little time we have, whether it's walking, swimming, whatever you can do, you need to do it so that you can reduce your chances of having all these non-communicable diseases. And if you think there's anything wrong in your health, in your body, you should seek for help as soon as possible. All right. we're still talking about women health issues. Finally, it's about the very young and the very elderly women. At the very extreme of the ages, there are risk factors. Our young girls, especially, we need to keep them safe. We need to ensure they go to school and not get married too early. We want them to be child, not bride. Okay, I know in some part of Africa, they still practicing child marriages, and these girls 13, 14 are getting married and trying to get pregnant, and most of them are having a hard time. They end up with what we call vagina fistula. We really need to advocate more to let our children grow up, at least be 16, 18 years actually, before they begin to even consider marriage. And that's why they need to go to school. Female education is very key. And when they are in school, they have time to develop, and they also have time to be financially empowered. And then by the time they are ready to have their own children, we find out that children of educated women, they tend to do better. They tend to survive. For those of us who are pediatricians, we are very concerned about child survival. We find out that women who are educated, the children tend to survive compared to uneducated women. And like I said, these young girls, they are prone to all this VVF and all that. So let's keep our young girls in school. Let's educate them. These days, there's no more difference between a girl and a girl child or a boy child. Those days, people say, I want to have boys because they want to carry the family name and all that. But those are no longer issues anymore. Whether you have girls, you can train them and they can be um, anything they want to be, and supportive. I've seen that even sometimes the girls supporting the family, even blazing the family name more than the boys. So let's make sure we take care of our young girls. Also, the older ages, women, they are prone to certain issues, things like menopause and all the symptoms that come with it. And of course, those cancers are also prone to affect more of the elderly women and all that. So these are things that they also will need support around. All right, so thank you so much for those of you who have listened to me so far. If you're just joining, we've been talking about women health issues. It was the World International Women's Day yesterday, 8th of March 2023. Every year we celebrate women on that day, and in honor of the International Women's Day, with the theme of embrace equity and spread love, I decided to take a break from my children health issues and to talk about the health of women. And women health are so crucial. We need our women to be alive. So we've looked at those 10 important issues that affect our women. We've looked at cancers, and we've talked about how to protect ourselves against cervical cancer and breast cancer, emphasizing the screening and early detection. We've talked about reproductive health. We talk about family planning. We've talked about pregnancies and how to ensure that we don't die from pregnancy, delivery, and the after effect. We've talked about HIV, and we've also talked about sexually transmitted infections, how to keep ourselves protected and safe. We've emphasized about violence against women. It's an epidemic. It's an health issue. But women should not be dying from violence. If you are in an abusive relationship, please speak out and get help. I've also talked about mental health issues, which affect women, and it's important that we get the right help as well. And finally, we talk about non-communicable disease, and we also talk about the elderly and the very young women and the peculiar health issues that they also have. So we as women, we have to be healthy. We have so much that we do for the society. We keep the world going rolling, if you like, and so we keep it working and going. So we are really very important. And for us to do all the multiple work we do as women, we got to be strong, we've got to be healthy. And so please, in this year 2023 International Women's Day, I want to say, please make your health a priority. All right, I know you're so vested in the children's health and the health of other family members, but I want to encourage you as a woman as well to make sure that you also prioritize your health. Remember, you need to be alive, which is what I always tell women. You need to be alive so that you can take care of your children, that you can enjoy all the fruits of your labor over your family, over your children. So you need to be alive. So your health is very key, is very important. So please, as you celebrate yourself as women, as wives, as mothers, as ladies, professionals, whatever hats or multiple hats you're wearing, I want you to also take care of your health as a woman. And if you have any health issues, please see your doctors. The gynecologists are the specialists for women health issues, especially reproductive health issues, but your general practitioners or your family doctor is also there to support you as well. And if you have any question about your health as a woman, feel free to post on our ATP family. Okay, we have two Facebook groups. We have the Ask the Pediatricians, which is for the children, and we also have the ATP family, which is actually for the adults, including women. So you can post your questions there from Mondays to Saturdays. Our family physicians and gynecologists and other professionals, they will be there to support you. And of course, we just bear with us. Sometimes it takes us up to 72 hours or more to answer your questions. But if it's not an emergency, we will get to it. But if it's urgent, an emergency, please go to the hospital. Don't waste time at all. So once again, I want to thank you so much for joining me today, and I want to also again wish all our ladies, especially all my Ask the Pediatricians Foundation members, all our Facebook groups, all our volunteers on each of our chapters, all our ATP chapter leaders. Most of them are ladies. We have men too, but we have more women. And all our moderators, most of them are ladies. All our professionals on our groups who have been helping us, our doctors, nurses. We want to say thank you to all of you. We want to celebrate you. We want to thank you for all that you do and all the support you have given to Ask the Pediatricians Foundation. And we want to encourage all our ladies to embrace equity and to spread love. Let's spread love. Let's spread love everywhere we go, in our homes, to our children, to our families, to even our neighbors, all over the world. We women, we're the salt, and let's make sure we spread that love and sweetness everywhere we go. So thank you so much for joining me today. And next week, I'll be coming back and I'll be speaking again on another important topic that has to do with the health of our children. I was going to speak about hearing and deafness because we especially celebrated the World Hearing Day a couple of days before the International Women's Day, but I just really feel like I need to give it to the women. I need to give it to the women, and that is why I decided to talk about women's health issues today. But hopefully next week we'll continue to talk about the health of our children. So till I see you then, have a wonderful day, and again, happy International Women's Day to you all. And it is bye from me. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.